Sarah. I'm doing our active learning activity, the microteaching activity on patient education. Just to give you a little background, this picks up after the class has already learned about assessing learner needs, just to give you an idea. And this is ideally for second semester students or students that have a solid background in patho, pharmacology, and medical or med-surg nursing preferred. So this is going to build on concepts from all of those things. So I'll begin with doing a lesson on essentials of patient education. So specifically, we're looking at behavioral objectives and why those are important. I've made a case study that we're going to do together, and then after the little bit of lecture here, a little bit of a PowerPoint presentation, I'm going to split you up into groups of 5, and you guys are each going to go over your own case study together, and at the end of class we're going to present on them, and we're going to go over the different behavioral objectives that you've created for your unique patient, given unique situations, and we'll see what we can learn from each other. First of all, what are behavioral objectives? Behavioral objectives are very specific. It's a single behavior that should be achieved at the end of a single educational experience. So it's action-oriented and learner-centered. This is all about what the patient is going to do and how they're going to do it, and by when. And we'll go over all the different components of behavioral objectives, but they should always be action-oriented and learner-centered. That's really important. The objective should specify what the patient should be able to do as a result of being taught. So again, it's very specific. An example of this would be a patient who has been newly diagnosed with diabetes will demonstrate the ability to correctly dial the correct dose and inject insulin using an insulin pen prior to being discharged. So it's very specific. It said what the patient's going to do. They're going to dial the correct dose. They're going to inject the insulin. How? Using the insulin pen, and when is this going to be done? Before discharge. Just to clarify, behavioral objectives are different than goals. Goals are very broad. You might have seen goals already in your clinical experience in the form of like a care plan. Maybe an example is for infection, let's say. The patient will be free of infection throughout the hospital stay. That's a very broad goal, and there's a lot of things that have to be done in order to achieve that goal. So those things would be objectives, and multiple objectives help you to reach an overall goal. Goals are the long term. Like I said, several objectives must be met prior to the goal being reached. And an example of a goal would be to kind of build on our example with the newly diagnosed diabetic patient. A goal would be a newly diagnosed diabetic patient will learn to effectively self-manage their diabetes. So you can see there's a lot of things that have to be done before someone can self-manage their diabetes. Lots of specific objectives. So why is it important to use behavioral objectives? It seems like common sense, we should just go in and teach our patients these things. We do it all the time at the bedside, but why is it important to not only create the behavioral objectives, but present them to your patients? For one, they help keep the teacher on track, and it keeps it learner-oriented. You want to prevent information overload. You want to go in there very intentional in your manner, and very as short and sweet as you can be, but to reach the behavioral objective, the purpose of your educational experience. It also helps the learners, though, understand what's expected of them. It's very clear. Before discharge, I want you to be able to dial up the dose of insulin on your pen and show me that you can inject it before you leave. So they understand what's expected of them as well. When you document your behavioral objectives, it also allows other healthcare members to know where the patient is as far as their education prior to going home. That helps them, say after your shift, the nurses that are taking care of the patient the next day, it helps them pick up where you left off, and they can continue to educate the patient. It focuses on the end result of the teaching encounter, which is it just keeps us on the right path, because it's easy to veer off when you're talking to a patient. There's a lot of things to cover with diseases like diabetes. There's a lot you could go over, so you want to make sure that you're sticking to one thing at one time, and that's beneficial for your patient. Also, it allows the teacher to clearly evaluate whether the session was successful. So if you create a behavioral objective, you can either meet it or not meet it. It's very clear-cut whether or not the patient needs more education. Or maybe the material presented in a different way. That's very possible too. Not all patients, we've learned already that not all patients are the same, and we have to cater to that as well. But that was, like I said, in the patient assessment of learning. Now we're building on that. A good rule to go by when you're making your behavioral objective is the ABCD rule. We love acronyms, we use a ton of them. This is a great one for behavioral objectives. Your A is going to be your audience. It's very simple. Who are you teaching? If it's a pediatric patient, are you teaching a 2-year-old how to do something, or are you teaching the parent? You got to make sure you know who your audience is. The behavior, what does the patient need to be able to do? Do they need to be able to check their blood sugar? Do they need to be able to identify how much sodium is in a can of soup, for example? C is the condition. Under which circumstances will the behavior be observed? So, example, the patient would demonstrate that they are injecting the insulin correctly, dialing up the dose of insulin and injecting it correctly. That's the condition. That's how they're going to prove to you that they know it. The degree is going to be how well the patient performs the behavior or within what time frame. So our patient is going to inject the insulin. We want to see it 2 times prior to discharge. So before they go home is our time frame, and they're going to perform that twice. So that's the degree. Inject the insulin, self-inject 2 times before discharge. That's the degree. And we'll go over, we'll see an example of this in action. I feel like audience and behavior are pretty easy. It's the condition and degree that gets marbled. But it's easier than that when you're making them yourselves. Remember the basics. Behavioral objectives will do no good if they're not based on a good assessment of the learner's needs. That's number one, most important. Have a good assessment of what your patient needs. The readiness to learn. Are they ready to hear this much information? They just got a brand new diagnosis. Are they able to take in that much information? Or should we be just giving them what they need in order to go home and be successful right away? If they're diabetic, they need to be able to check their blood sugar. They need to be able to give themselves insulin. They need to know the signs and symptoms of hypoglycemia and hyperglycemia. Those are all like life-saving and safety concerns that we should be prioritizing for our patient. The rest can be taught at different times in follow-up appointments. We're focusing for this class, this situation, on acute inpatient, on your medical surgical floor patients. So what are they needing before they go home? Like I said, the tendency is to provide too much information. So like I said, we know a lot about these illnesses. We've studied them. Patients may have just gotten diagnosed with them, and that's way too much information for them. So that's the tendency, is to give too much information. And we do it because we care, but sometimes it can be counterproductive, and they can lose the important things that they need to know within all of that information that we're giving them. So always prioritize your objectives that pertain to patient safety, and we talked about that. So to put it all together, this is just a case study that we're going to do together.
Hang on. Okay.
Okay.
I can't see you. Scoop. You're at 9. Oh, go.
Okay. All right, so this is before we break up into our own groups. This is, and I printed it out for you guys, but it's the case of JW, who is a 55-year-old female patient with newly diagnosed type 2 diabetes. She was admitted late last night with hyperosmolar hyperglycemia non-ketotic syndrome. During rounds, the doctor mentions that they plan to send the patient home tomorrow with metformin and insulin glargine, Lantus, for diabetes management. Okay. So this is your learning needs assessment. You have assessed the following needs for the patient after having a conversation with her. 1, the patient needs to learn how to check her blood sugar. She needs to learn how to self-administer the insulin. She's going on the Lantus. She needs to be aware of what the new medications do. So metformin and Lantus, how those medications work. She needs to know the signs and symptoms of hypoglycemia and hyperglycemia and how each of those are treated or what she should do in the case that either happen. And the patient, you find also that the patient is not confident that she knows how to follow a diabetic diet. So a lot of needs that you've assessed. In addition, you assess her readiness to learn. And after conversations with the patient, you recognize that she is receptive in asking thoughtful questions about how to manage her care at home. So she has a husband at home for support. Her job keeps her very busy, and she does not go to her provider as often as she should, as she puts it. You determine that she is ready to learn and help her prioritize her learning needs based on this. You acknowledge that she has a support system and that she's wanting to learn how to take care of herself, but she does have some barriers. A busy job and a new diagnosis is a barrier in and of itself. We learned previously. Okay, so we also, to build on the learning needs, remember your PEAK acronyms. So the physical readiness, the emotional readiness, experiential readiness, and your knowledge readiness. So to keep that in mind for her. That's just a recap. We've been over that lots, so keep that in mind when you're doing your case studies. In learning style, you ask her, simple as that, you ask her, how do you learn the best? And she tells you that she's most comfortable with hands-on demonstrations, and she likes to have material to read after the demonstration, which is that's common, and that's great. That's great for her needs, given that she's going to have to probably demonstrate how to give herself the insulin and demonstrate checking her blood sugar. So that is good. So what's a good goal for her? An example would be JW will independently manage her diabetes at home. So like I said, very broad, very general. It's going to take a lot to get us there, but that's our overall goal. Number 2, of the learning needs that you identified, which 3 are your top priorities for the patient? So we gave you a long list. What are you going to prioritize with her? Because you only have a limited amount of time. For example, this is me. We all have, there are not 3 perfect priorities, but there is a right and wrong answer in that you want to be prioritizing the ones that pertain to patient safety, but there's not 3 perfect priorities. I just identified that, number 1, the patient needs to know the signs and symptoms of hypoglycemia and hyperglycemia and how to treat both and what to do if they were to happen. Second, objective that I prioritized was the patient needs to learn how to check her blood sugar. It's very important. That guides the administration of all the medications that we give to treat diabetes. The third objective that I prioritized was the patient needs to learn how to self-administer insulin. So from this, I created 3 behavioral objectives. Again, this is not the only answer. This is not there is no right and wrong, but this is what I identified for this patient. And you're going to get to do the same for your guys' patients. 1, I said the patient will identify 3 major signs and symptoms of hypoglycemia and hyperglycemia by the end of the learning session. So she can write them down for me, read them back, list them off. Either way, she's going to identify 3 signs and symptoms of hypoglycemia and hyperglycemia by the end of the learning session. And I'm going to know that she met this if she, A, can list 3. That's how I'm going to know. That's why you have to be very specific. If she can't identify 3 because I'm going to cover more than 3, then I know that I need to go back and possibly reframe what I said, or maybe get her a different method of learning. Maybe she needs something that she can read in order to understand these. I would have to go back and reevaluate. The second objective that I created was the patient will demonstrate the correct procedure for checking a blood glucose level 2 times prior to discharge. So she is going to demonstrate, and she's going to do it 2 times before she leaves, and that's how we know she either met or did not meet the behavioral objective. And number 3, the patient will demonstrate the proper procedure for self-administering insulin 2 times prior to discharge. So that, again, she's going to demonstrate giving her insulin, and we're going to do that twice before she has met the objective. All right, so I want you from this, if you have any questions, now's a good time to ask. If you have anything that you saw from the previous case study that you want to ask about, or maybe you saw something different that I didn't see, go ahead, and now's a good time to discuss that. And after that, we're going to organize into groups of 5. I have printed out case studies for you of 5 different patients. You're going to be in groups of 5. I want you to identify a goal, and then I want you to prioritize the learning needs, and after that create at least 2 behavioral objectives from the learning needs that you identified, and I want you to explain how you prioritize them. So it's very comprehensive. It goes over everything that we've just covered. There's a lot of information, but just remember to go back to your basics of a good learning assessment and use your ABCD rule when you're creating your objectives.